This is something that is very applicable to our audience today, osteoporosis. About 54 million Americans have either osteoporosis or low bone density of some sort. And it's the silent threat that's out there. It comes on postmenopausal. It increases the risk. You get decreased bone density and bone fragility, and about 7,000 spinal fractures occur a year. So that's compression fractures. And if you look at this over here, really what it just is, the density, you can see these little bridging kind of interwoven matrix that's in a normal vertebrae. What happens is you start to lose the density of those little matrix weaving together, and then you have more dead space in between. And as you can imagine, if you have less cross-linking, it's going to weaken the structure until such time that it finally fails. And unfortunately, you'll have no symptoms of osteoporosis by itself until something fails. The most common areas of fracture are in the spine, whether it be the thoracic spine or lumbar spine, and it's most commonly at the thoracolumbar junction, so that's right down at the bottom of the thorax or upper lumbar spine. And what will happen is once it fractures, you tend to kind of fall forward, and once you've had one, you're at risk for another one. Fractures occur in otherwise healthy individuals. Just kind of comes out of nowhere, and it's minimal trauma, sneezing, coughing, even sitting down hard. And the classic thing that I hear when people come in is, I wasn't doing anything. That's it. I wasn't doing anything, and all of a sudden the pain comes on, this intense stabbing pain in the back. And so this picture over on the side, once again, this is just the same concept just in the hip. Right, so this is the femoral head, and here's the trochanter and down the femoral shaft. And so you'll see that this is a higher density kind of matrix than this over here. And once again, it's just physics. It just comes down to physics. When you start losing those cross links, it starts to become weaker. So osteoporosis, the non-modifiable risk factors, you can't change that you're female. You get decreased estrogen postmenopausal. Men start getting decreased testosterone. European and Asian ancestry increase the risk. There's other hereditary links. Early menopause and then a hysterectomy. If you had a hysterectomy at an early age, you're going to be at increased risk. Now, the modifiable types of risks, dietary, vitamin D, too much, smoking at all, excessive alcohol. So that means the 2-martini lunch is okay, but the 3-martini lunch, it's a little, that might push you over the edge. Has anybody already hit that mark today? So malnutrition, underweight, and then inactivity, but then also endurance training. So it's kind of the two opposite ends of that spectrum. So inactivity, you're not putting enough stress on the bone, so it will not go ahead and remodel the way it should and stay strong, so it starts to just go away. Endurance training, however, you see these women that are in great shape, or what would appear to be great shape, but when they deplete their fat stores, when their body fat gets so low, they decrease their estrogen production. Sometimes they become amenorrheic, so they don't even have periods, and so that puts you in a whole other category of risk for osteoporosis. Then medical conditions, rheumatoid arthritis, hypothyroidism, diabetes, lupus, renal failure. Those are some common ones. And this is it's kind of, you're damned if you do, you're damned if you don't. Drugs, steroids, which are used to treat rheumatoid arthritis. So you already got one strike against you if you got rheumatoid arthritis, and then one of the medications to treat it actually can perpetuate or make it a little bit worse. Hypothyroidism, you're using thyroid replacement for the hypothyroidism, but that in and of itself is another risk factor. And then Coumadin, a blood thinner, that actually can have an effect as well. So bone is constantly remodeling. Cells are breaking down bone and rebuilding bone. This is the natural course, the natural progression. And I don't know if, this may be the wrong analogy, but Thai fighters, the fighters from Thailand, they do a lot of kicks. And one of the things they'll do starting at a very early age is they take bamboo sticks and they hit themselves on the shins over and over and over again. And what it does is it causes micro fractures, but it remodels the bone because they're putting an outside stress onto their shin. So it's an extreme example of how you can actually modify your bone density, and then their shins, become like steel. And so that's what it's exactly intended for. Now, that doesn't really apply to you guys. But, I mean, unless you're going to pick up Thai fighting sometime soon. I wouldn't recommend it, however. I might be seeing a lot of you then. But the same can be said for any bones in the body. If you don't use it, you start losing it. And so inactivity will lead to progression of osteoporosis. So it's very important that you put those bones under stress and strain each day with whatever type of exercise you're able to do.